It is great to be here this morning with some amazing panelists to have a really great discussion about access and needs for mental health in the Latino community, but also for communities of color. So just to get us started, I'm going to start with some introductions. First, we have Sheriff Gonzales, who is the 30th Sheriff of Texas's most populous county, Harris County. I just have to say before I do some highlights, Sheriff, you are wonderful and are doing some amazing things, and it's quite an honor to be here to help moderate this session and to have you join us. But Sheriff Gonzales has elevated discussions on mental health, substance abuse, homelessness, and rehabilitation programs and services. He also prioritizes innovation and collaboration regarding the care and response to those with mental illness, development disabilities, and neurocognitive disorders. He established a telehealth program and invested in critical intervention and de-escalation training. So again, Sheriff Gonzales, thank you for being here with us today.
Thank you, my pleasure.
Thanks. Also with us is Dr. Sylvia Muzquiz, who is the current Vice President for Mental Health Medical Services at the Harris Center for Mental Health and IDD. She provides direction and oversight for patient care within the outpatient services. In addition, she leads multiple education programs and sits as a medical chair for the Utilization Management Committee for the agency. So, Dr. Muzquiz, thank you for being here with us today.
Thank you, my pleasure.
And then we will have joining us shortly, I know technical difficulties this morning, but we will also have Wayne Young, who is the Chief Executive Officer for one of the largest behavioral health organizations in the nation. He is passionate about planning and delivery of large-scale behavioral health and intellectual and development disabilities services to a population who rely upon safety net service or systems of care. He previously served as the chair of the Texas Health and Human Services Commission's Behavioral Health Advisory Council and was recently appointed by the Supreme Court of Texas to the Texas Judicial Commission on Mental Health. So again, Mr. Young will be joining us very, very shortly. So before we get started, I wanted to just give a quick background information about the Harris Center, a little bit about Harris County, to just really lay a basic understanding as we dive into the discussion portion of the conversation. So the Harris Center is the largest mental health and developmental disabilities care center in Texas. They partner with hundreds of community advocacy organizations, hospitals, foundations, government entities, nonprofit groups, and others to connect consumers with the best available care. Their mission is to transform the lives of people with mental illness and intellectual and developmental disabilities through the provision of high-quality services that include community outreach and education. The Harris Center is accredited by the Commission Accreditation of Rehabilitation Facilities, the Certified Community Behavioral Health Clinics, and the behavioral health clinics. Also, of course, Harris County. So Harris County Sheriff's Office is the largest sheriff's office in Texas and the third largest in the nation. They have nearly 5,100 employees and 200 volunteers dedicated to ensuring the safety of more than 4.1 million residents who call Harris County home. They have 3 specialized patrol behavioral health response programs, the Crisis Intervention Response Team, CIRT. So if you hear us reference CIRT, you now know what that is. The Homeless Outreach Team, HOT, and the Clinician and Officer Remote Evaluation, CORE. Harris County Sheriff's Office is one of the 5 law enforcement agencies nationwide selected as a law enforcement mental health learning site by the Council of State Governments Justice Center. And we could put more information about these in the chats and make sure we share all those resources as well. So the Harris Center and Harris County Sheriff's Office have a really strong relationship that's led to many successful programs. Their partnership has truly transformed the lives of those behavioral health concerns and also has allowed for the diversion of thousands of individuals. So as we go forward, our goal is to have a conversation with both the Harris Center and the Harris County Sheriff's Office. And hopefully this will provide those of us who are throughout the country, myself, those also in attendance, just a really good understanding of programs that are out there, maybe some things that we could bring back to our communities, and understanding of funding, how this all came to be, because these are problems that are consistent throughout all of our counties. And so hearing what's out there and hearing what's been successful is so beneficial to all of us. And then, of course, at the end, there will be time for questions. So we will be monitoring it. You can always, if you have questions throughout and you don't want to forget, you can actually just put them. There should be a chat. We'll be monitoring that, and Mercedes will be helping. And Mercedes, I forgot to introduce you, but Mercedes Sanchez is actually a great NACO member. She's part of our planning committee, and she is with Commissioner Garcia, who's actually also out of Harris County. So thank you, Mercedes, for helping us with this today. So we'll go ahead and get started. So my first question is for you, Sheriff Gonzales. We know that our county jails historically have been community's largest provider for mental and behavioral health services. Can you share with us some of the programs and trainings related to behavioral health that your organization has implemented to address some of those needs?
Yes, great to be with you and everyone that's tuning in, and great to just have this conversation on such a critical issue. For me, in policing in the modern era, we're all grappling with three important issues. We're on the front lines of three critical issues. That's mental health, addiction, and poverty. And I don't care what part of the country we're at, that's what policing is grappling with. That's what many of your local communities are grappling with. And I hope that some of the things that we've learned and been able to implement here, that you understand that it's also scalable. If you have a larger jurisdiction, you can scale up. If you have something smaller, you can also scale down. Yeah, for us, training is foundational to the work that we do. So one of the things that I wanted to do is make sure, first of all, that our frontline personnel in particular had all the necessary crisis intervention training. So now we make sure that we provide that annually to just about everybody, refresher courses as well. We're also always seeking evidence-based programs that are kind of considered best practices. One of them, for example, is called ICAT from the Police Executive Research Forum. That's a trusted policing organization. ICAT is Integrated Communications, Assessment, and Tactics. What we wanted to make sure that our frontline deputies knew is that to try to really take the time to assess when they were arriving somewhere, to try to understand that it may not just be somebody that's being combative because that's what they want to do. It's because maybe they're in a situation of crisis. Take the time to really assess what's going on. Look, the person may even be armed with a knife, for example, but if you gain space and distance and time, then hopefully you could de-escalate that situation. So that's one example. The other one that you referenced was our core program, the clinician and officer remote evaluation program. We're so proud of that. That's a great collaboration between us and the Harris Center, where again, any jurisdiction, especially those smaller, more remote locations that maybe don't have a lot of resources in their own community, now you could, look, we're all on using our tablets and iPads and computers to tune in right now. Similarly, if we're out in a situation of crisis, we could open up that iPad, connect with a clinician, a mental health clinician or expert remotely, and be able to triage what's going on with that person. We're not the experts. At the end of the day, we're peace officers. We're not mental health professionals. So being able to just be that conduit that connects the person that we're responding, that may be in crisis, to the professional, hopefully leads to a better outcome for everybody. For us as peace officers, obviously for the individuals that we're trying to serve and protect, and also to the community at large. So those are two examples of something that we're doing. Us being a certified Department of Justice training site for mental health has really created an opportunity where so many come to our jurisdiction from near and far, not only nationally, but also from around the globe, to come and see how we're trying to address mental health in our community.
That's so great to hear. And thank you for providing us with the information. So this next question is for Wayne, and Wayne, welcome. You missed us giving your lovely bio. That's okay. It's been a fun day of technical difficulties, but we're here. So Wayne, from a behavioral health provider standpoint, can you talk about some of the challenges of implementing the core program? What are some of the lessons you've learned from it?
Yeah, absolutely. And I appreciate the patience, and the technology was a bit of a challenge, although I never am concerned about missing the introduction. That always makes me a little uncomfortable for somebody to talk that long about me anyway. So the early part was frankly getting our team comfortable with thinking differently about how we might engage and provide connection with individuals, right? We've got, I've done a lot of work around criminal justice involved individuals and provide a lot of services to a lot of people. But this was a different approach. And so as you change those patterns and change processes, you have to help people become comfortable with that, create a vision for it. We also wanted to make sure we were still HIPAA compliant. We wanted to make sure that we respected the confidentiality of those that were being served. There were some technical challenges around, if you think about it, if, you know, as I sit kind of close to a highway here in my building, if you're next to a highway and you've got a tablet, trying to make sure that you can hear the person and they can hear you. And if it's dark outside, trying to be able to see their face and ensure that they can see you. And so there was a lot of kind of change management kind of things that we had to do, everything from staff orientation and comfort and getting everybody aligned with it, all the way to the technical pieces. So we have lamps that you can hang around your neck that shine a light on your face. We have speakers that you can connect to the iPads if it's a little too loud. So there are lots of accommodations that we've been able to kind of work through.
That's great and interesting about the lamp necklace.
Yeah.
Didn't even know that existed.
Yeah.
Huh. So this is a follow-up question for both Sheriff and also for you, Wayne, is what type of resources were needed to implement the core program? I mean, just based off of some of the stuff you're thinking, I'm thinking financial resources, but if you can give us an overview, both of you, what resources were needed to get this going, that'd be great.
So I'll start and then certainly let Sheriff Gonzales bring it home and really make the good points. But I think we started with just good intent, right? Like we didn't start with resources. I think we all knew that there was a good idea here, but it wasn't fundable. There wasn't a model to ask people for money. And so the sheriff designated some of his staff that he already had as a part of his team. I designated some staff that I had. And we said, let's try it. Like, let's see how it works. And then invited outside partners to the table, University of Houston downtown specifically. And honestly, they came in as a partner with the sheriff's office to do that evaluation. We felt like that might be the best approach for funding for that evaluation. And we did. The sheriff and his team wrote a grant, got funded through a foundation for the evaluation. As a part of that evaluation, then they began to provide us with impact and outcomes. And a policy statement, and frankly, an implementation guide that they helped fund the writing of. And then we took that information along with the sheriff. The sheriff obviously has a large voice in our community and can really get people's attention and support. And so I rode his coattails as we went and asked for funding. And ultimately, to bring it to the scale that we had, we asked for a little bit less than $1 million. To support, I think we ended up with almost 200 tablets, 150 tablets, and all the clinicians to answer those calls. The technology piece is relatively inexpensive, but the counselors that are available to answer the calls becomes a little bit tricky. And so what else would you add from that, Sheriff?
Yeah, I think Wayne already touched on some very key parts to it. The only thing I would add, and I think he kind of referenced it, it's just the importance of collaboration. You have to have individuals at the table that are collaborative by nature, not territorial, that we could bring our expertise to the table. That would absolutely be one of them. And then, again, making sure that we're not afraid to just kind of get started. This started first as a pilot program. And then eventually, as he mentioned, I believe it was 2020 when we finally got it funded completely. And now it's spread to over 14 different agencies within our county, thanks to the collaboration. And you need to find champions, people that believe in this, because you could have all the technology to make it work, but if you don't have people to believe in it, it's just going to get stuck. And both Wayne and his teams and myself and many others like Sergeant Gomez and now Chief Deputy Lee and others that were willing to really push this and really sell it and really be able to highlight the benefits to our community. And so I think the collaboration, not being afraid to start, and then again, making sure you're finding champions. To me, that's been one of the key, being an elected official. Anytime we really wanted something to be successful was finding someone to really champion it, that could believe in it. And just about every program we've been able to implement at the Sheriff's Office, either through myself or someone else, it's because somebody believed in the program and is really willing to do the hard work to make it happen.
And I want to just add there, I don't want this sheriff to sell himself short, right? He's created a culture and a climate and a set of values in his department that allows people to do just that. And so he, his people are tremendous and they do tremendous work, but I also know under different leadership that might not be possible. And so, having leaders like the sheriff who will be willing to accept a little bit of, thinking differently. And there's a little opportunity for failure, right? We went into this not knowing if we thought it was a good idea, but I've had plenty of good ideas that always weren't so great at the end of the day, right? And so his willingness to have a little tolerance for that and to support his team with taking those chances and innovating goes a long, long way to making that happen. I just want to give kudos and the recognition that that's a very real part of this process.
Thank you, Wayne.
Yeah, thank you, Wayne, for saying that. And yeah, this is great. I'm very impressed with what you guys are doing. So Dr. Muzquiz, this is for you. Harris County is one of the most diverse counties in the country. Latinos make up over 44% of the population, and there are over 90 languages and cultures represented among your population. What has the Harris Center done to ensure that a non-English speaking patient can access needed services?
Yeah, no, so I think that's a good question. And I usually like to compare Harris Center to the Southern New York City, because I think it's pretty equivalent with diversity and culture and languages. At the Harris Center, we've identified over 40 plus languages for individuals who have actually come to seek our services. And I think, one of the key things that we try to do is focus to hiring bilingual providers, but obviously that's very hard to do to cover all these many different languages. So we partner with Language Line and in-person interpreter agencies to ensure, communication. As mentioned earlier, technology has been a significant part for us being able to reach non-English speaking patients. I mean, we have in-person visits along with telehealth services to help facilitate access to needed services.
That's great, because I know that is as a struggle for many of our communities, is trying to get access in the language that their native language is really important. So follow-up question for you, Dr. Muzquiz, is what are some strategies to overcome stigma about mental illness at a clinical level within the Latino population?
Yeah, no, I think that's a great question. So there used to be a public health announcement that would run on television when I lived in Mexico, and it said, "Hablando se entiende la gente." I think it pushed the importance of communication and how communication can help build trusting relationships. So I think we need to provide a personal approach where we need Latino multidisciplinary treatment teams that speak the language and understand the culture and the trauma that many have endured to get to this country. I think in these multidisciplinary teams, I would focus on our peer partners. And for those that don't know what peer partners are, they are individuals who are familiar, who have had lived experience with mental illness, and they've gone through a training, they've certified, and they've helped others on their road to recovery from mental health. I think in addition to peer partners that can be helpful in reaching out to the community, I think other community outreach partners like the promotoras, I know that model, the promotoras model, has been very effective in general healthcare. And I think focusing on maybe having behavioral health promotoras can help reach vulnerable and underserviced members of the Latino and Hispanic population. I think, increasing hosting Spanish community events that focus on education about mental illness, resources available, and of course, adapting many of the materials into Spanish.
Great, thank you for that. So now Sheriff Gonzales, there are a lot of stigmas within Latino community when it comes to law enforcement as well. Many times people are scared to report a crime or cooperate with law enforcement. What has your agency done to bridge that gap?
Well, first of all, it's understanding, like you said, that the stigma is real. You know, being Latino, growing up in a Latino household, I know that many times it's taboo to talk about anything related to mental illness, or, you know, as many of us would say, está loco, or, you know, just blowing it off. And so we need to make sure that we have honest conversations about that, not being afraid to open up conversations about suicide, about mental health, that it's okay not to be okay. It's okay to seek help. It's okay to, you know, do all of these things. And so to that end, one of the things I'm very happy about is I launched Unidos. It's a program that I did not create per se. It was borrowed from a North Texas police agency that had started years ago. But the goal was identifying bilingual deputies within our agency that could go and be those trusted messengers, deliver information in a bilingual and bicultural way, that we could be present at different events. And it's been a tremendous success. We've been able to go directly into the various consulates, such as the Mexican consulate, the Colombian consulate, and others, give information to empower the community, to give them information in safe places. We meet them where they're at. And again, deliver information about a wide range of subjects, whether it be, again, mental health awareness or many other things. And so being able to deliver that in a way that feels comfortable to them, and again, being where they're at, has been a tremendous success. It's called Unidos. It's, again, a group of deputies that take out Spanish-speaking literature. We take other swag out there as well, and just engage in a very positive way has been one of the strategies that we use to really try to amplify important messages in the community, whether it be traffic safety, for example, also domestic violence awareness about the impacts of domestic violence. We know it's prevalent in the Latino community, and that trauma that sometimes those children in the household experience as a result, that secondary trauma, or sometimes direct, through some of the things that they witness in their household. So again, there's a lot of issues for us to tackle, but I think that's the importance of these convenings like you're having here today, is for us to talk about it and say it's happening all over the country, not just in Harris County. It's not unique to us.
And that's very true. It is happening all over the country. And so this is a great, again, resource for all of us to hear about the programs and think about how we can bring it back to our communities.
Mm-hmm.
So Wayne, this next question is for you. Can you tell us about the innovative community outreach programs that the Harris Center is using to increase access to hard to reach communities?
Yeah, absolutely. We've got several of them. The one that comes to mind first falls under the umbrella of what is, it's kind of a newly evolving approach. It's called community initiated care. And it is the idea of going into communities and helping develop the skills and knowledge within communities for them to respond to low-level behavioral health needs in that community context. So you think about going in and partnering in ways that they drive and want, right? So we don't tell them this is what you need. They tell us this is what we want. But you go in and help them build those skills, and you start with partners. You start with influencers and community members. You think about barbers, you think about daycare workers, you think about people that are working at food banks, and you go in and you're not trying to turn them into counselors, right? There's a role and a place for licensed counselors and psychiatrists as well trained as Dr. Muskie, but you go in and try and help them with basic skills and recognition to help normalize that conversation, and then help them with knowledge of how do you help them connect with the more formal systems of care, should they need it, right? Should they need more support? Should they need more care? We've got 10 neighborhoods in our community that we identified as the first implementation of this model. And it's, to our knowledge, it's the largest implementation of its kind at this scale in any community in our country. And we identified those 10 zip codes because they had 3 things that were kind of working against them. They had a higher number of suicides than any other zip codes in our community. They had the largest impact from COVID, the most disproportionate impact from COVID, and they had the lowest utilization of us as their community mental health center. And so those three things got them on the list, and we then began to go out and do that engagement and partnership. And it's paying dividends. It also, while our focus isn't to increase professional service utilization, that has been the impact. We've begun to increase utilization from those zip codes where they were hard to reach or perhaps not as comfortable engaging with us. It has had that effect. The other thing I'll talk about is a few kind of innovative ways where we go into that community, where we leverage existing relationships in the community, our partnerships or locations. A great example is a couple of community centers. Most recently, we did a ribbon cutting for a telehealth booth. Think of kind of like a phone booth. It's more private. It's not open glass, but and in this phone booth or telehealth booth is a portal, a tablet that's secure, it's HIPAA compliant, and it can connect to both us as well as our safety net hospital district here in our community. And so a community member just going to the community center can see that pod. It's right there visible when you walk in the door, can go in there, say, hey, I need some help, connect to one of our clinicians and begin to receive services and connect to both of our agencies from that portal. We also have a smart pod that was really built to be deployed when the Ebola crisis came about. It's somewhat mobile, but semi-permanent, and it's in the parking lot of one of our community centers. Another thing, we just took delivery of a mobile behavioral health clinic where we can take that clinic and go into various areas within our community to make access to services more readily available for those that might have transportation challenges, might have hesitation. And now we're beginning the process to help engage our community members to help us think about where should the regular stops, if you will, of that mobile clinic be? Are there particular apartment complexes? Are there particular neighborhoods? Are there other community centers, libraries where our presence would be a tremendous benefit and boon to them being able to access care? So all of those are things that we are, kind of leaning in on creating improved access and engagement.
This all sounds great. Now I have a follow-up question for you is how are all these programs being funded and what does your budget look like? Because I think that's for all of us as we're hearing this is how are these programs being funded? What's the budget like? How is this, going forward as well financially?
Yeah. So in the true spirit of a community mental health center, it is a lot of braided funding, right? There's a lot of complexity to it. So I have federal dollars, I have state dollars, I have local dollars. Our county provides a great deal of support to us. We have earned dollars. We have philanthropic support. That mobile clinic that I described, completely paid for by philanthropic grants. We're not spending a penny on it. There are 3 foundations in our community who made that investment and helped us bring that kind of vision to fruition. Some of the money we've been given are ARPA, the community initiated care model that I described is ARPA funded. And so we have to think about, does that end or are there some sustainable ways of approaching this? But it is varied and complex. On the whole, my operating budget this year is around $325 million. So just, that supports about 2,700 behavioral health and IDD employees. So just for kind of context and scale around that.
Thank you for that. So Sheriff Gonzales, your agency has been great at not criminalizing individuals who are experiencing homelessness and individuals who may be experiencing a mental health crisis. Can you talk about your agency's efforts to respond to emergency calls to individuals in a serious mental health crisis?
Yes, well, again, ICAT is one of them, the program that I referenced earlier, and all these different programs. We have a very robust homeless outreach team that goes out proactively and trying to, again, meet people where they're at to try to see those that may be needing services like housing or other type of support. One of the things that we partnered that Mercedes, that's a part of this as well, has been instrumental in is the development of the Employee to Empower program. It's an award-winning program recognized by NACO and others, where we identify individuals that may be homeless that are ready to kind of seek other support, and working with community partners and obviously through the support of the Commissioner Garcia, we've been able to get them a living wage We get them jobs that they could do in benefit of the community, and we're a part of that effort as well to kind of offer some of that structure and safety to that program and make sure that we're mentoring and guiding individuals. So we're really, again, trying to think outside the box and trying to be innovative, as well as, again, like I said, our training to make sure that we're being responsive, that we understand that these issues are incredibly complex and one size doesn't fit all. And so those are things that for us, that we've tried to do, is really understand that it takes a multi-pronged approach, whether it be being out in the field or supporting programs or partners like Harris Center. And to your previous question real quick as well about funding, like I was mentioning earlier, again, having been an elected official, I know sometimes we think, well, they're a big city, a big region, big county, we're smaller. Would encourage you to not let those things be a setback. You could, if you have a regional chamber of commerce, for example, there's a lot of businesses that are already involved that want to see that community prosper. Reach out to them, write letters to them. You'll find you'll be surprised how much support is out there. They see something good in the making that will benefit the community. Many already understand inherently that there's a problem, that mental illness is something serious. They may be impacted by it in some form or fashion. So we got to put our thinking hats on and think outside the box. Those resources are out there. And sometimes if you build it, they will come sometimes. And again, start off with a pilot program and then show proof of concept. And then from there, maybe some other funding sources open up.
And since you brought up funding and resources, so is it possible for some of the programs that you have to scale up or down to accommodate just the different funding levels that some of us can actually get to get these things started?
Oh, absolutely. Again, I've in my previous life, I also served on city council. I was mayor pro tem here in the city of Houston. So, you have to be creative, and we were able to launch. Mercedes was very hands-on in the creation of wonderful programs that are still in place today, like Cafe College, that provides a one-stop shop where Latino families and others can come and get information about workforce programs and scholarships and helping them fill out FAFSA forms and all that. All of those were collaborations between, my office, the city of Houston, the public library, and other donors that would come in and support. So, one of the things that we've tried to perfect over the years is just building partnerships, identifying those partnerships. And so all of these things are very scalable. Again, and sometimes start as a pilot program. That way there's not a huge investment of resources, but you could, again, show proof of concept. And then from there, there's a lot of grants out there. And once you can show, look, we started as a pilot program for 6 months. This is how many people we served. The philanthropic community could step in. Many other businesses will step in. You'll be surprised how things will come up. And back to finding a champion, especially for smaller jurisdictions, we've seen success in other jurisdictions where there was no position or funded position to run the program. Just somebody raised their hand and said, you know what, I'm passionate about this. I'm willing to get it started. And then from there, again, show proof of concept and it would show that it could be successful.
That's great information, because I know for so many of us, funding I feel always the barrier that we always put forth is, well, there's not enough money, there's not enough resources. So it's so great to hear you saying, just it isn't about the size, it's about, putting, if you build it, they will come type of mentality. And I think that's really great.
Yes.
So to ask you a follow-up, because I'm looking at the notes here and I'm curious about some of the training you guys do. And I have a note here for ICAT. Yeah.
Mm-hmm.
If you could talk a little bit about that training, because it looks like it was developed by the Police Executive Research Forum.
Correct. Yeah, we're always trying to push the envelope here and trying to see evidence-based programs that are out there. We're not necessarily the experts for everything. We just learned certain things that have worked for us and not afraid to try new things. So again, that's a program that really educates our frontline deputies on the better assessing what they may be confronting. Sometimes we respond to situations where someone's armed with a knife. And again, I don't want to minimize that for law enforcement. That's not obviously a very a dangerous type of situation. But what we want to just instill is the assessing part of it, slowing things down a little bit, trying to de-escalate the situation, and to incorporate all of these different trainings and teachings kind of into one program, so that when they go immediately, they could try to de-escalate some of these things. Sometimes in law enforcement, we want to rush and neutralize the threat, if you will. And sometimes simply by stepping back and buying time, trying to assess what's going on, could hopefully lead to a better outcome and try to lead to a successful situation where we put ourselves right in front of the person, and now the person makes a quick move, they're armed with a knife or something. Now, yeah, we may have to resort to deadly force. And so we've had a great success with that. These situations, are very complex. They're not perfect. We're not always going to get it right. But again, I think there's an intent to try to see what's out there that we could teach our deputies. It's been very well received. We teach it to the supervisors as well. And again, with us being a Department of Justice training site, we have people that come all over the country really to come and learn and see some of the things that we're doing and how we're implementing it. And as a leader, I want to say that the introductory video to that, when we start teaching the class, has an introductory video for me, the head of the agency, because so many times you as a leader, you set the tone in your community, you set the tone for the success. Don't give up that power. You simply, as a trusted leader in your community, could say, look, mental health services or developing more services are critical in our community. This is what we're seeing, and that's why this work matters. It gives tremendous credibility to that. And so that's what I try to introduce to that program, to say, this is important for our agency, for you to be successful as a peace officer, and obviously to keep our community safe as well.
Thank you for that. That was great. And so I guess I'm going to ask Wayne a follow-up to that is, can you share with us what you think is a success of establishing a partnership between law enforcement and the behavioral health community? And what's your advice to other jurisdictions that may want to replicate this model and some of the things that the sheriff just described to us?
Yeah, absolutely. Well, as the sheriff mentioned, so they're a training site from the National Council of Government and are well recognized. And oftentimes people come into our community and they see all these programs and they see our diversion center, and there is that, how do we start? How do we do this? And I try and remind them that this took decades to build, right? This wasn't something that, suddenly the sheriff called me up and we went to lunch and we have this really robust system that's well connected and well integrated. It took time, and a lot of that time was spent building trust. I talk a lot about our diversion center. We've diverted almost 8,000 people from jail since we started it almost 5 years ago. And it's been tremendously impactful in our community and helped decriminalize mental illness in very real ways. But that happened quickly and readily because we had trust between our agencies. I knew the bounds, I knew where we were at. And also, if there are behavioral health leaders listening, part of this is, like, I know my goals for diversion, right? My goals are to help people find recovery and maintain behavioral health stability and get well and get on medications. And I know that the sheriff and our other criminal justice leaders want that same thing, but I also know that the sheriff wants there to be fewer people in jail, right? And I know the DA wants there to be less charges that they're trying to prosecute. And even from them, I know that the Houston Police Department, they want less contacts on the street, right, with that individual. And so thinking as a behavioral health leader, not just about what my priorities might be, but what are the priorities of my partners, and how do we integrate that? How does that become important to me as well as the person leading the diversion center? And how do I make that a part of our focus and priority, and make room at that table? And I would also say, you don't think about it, right? None of us went to whatever training program we went to in behavioral health and really put a strong emphasis in law enforcement and collaboration. And so those systems are foreign to us. We don't know how to engage them. We don't know how to partner. We often don't even know how to reach out and make those contacts. And so I would encourage my partners that are on the law enforcement and criminal justice side of that equation to be proactive, reach out. I will almost bet you, if you reach out to your community mental health center and say, hey, I'd like to have lunch with you, they will show up, right? And so if you open that door, I think you'll find more willing partners than what you might realize, just because we're not always sure how to partner and engage in that way.
And I think that's great. I just turned off the FQHC board for Northern Arizona, but that's a big thing, is just reach out. They want to see us there because they don't know how to reach out to us necessarily. They think there's this barrier. So sometimes we have to be proactive to really get ourselves in there and learn more about what they're doing and how to support. So
And I'll
thank
say,
you
if
for
anybody
doing
on this
that.
call that's in the criminal justice side reaches out to their mental health person and they don't agree to go to lunch, call me. I'll help. I'll reach out. So please just go have lunch, break bread, have breakfast, whatever it may be. I'll be an advocate for you to help create that if I can be in any way.
Yeah, and if I could just add, because
Yes.
I've been with the Community Mental Health Center for quite some time. And I mean, this is truly a shout out to Sheriff Gonzales and Commissioner Garcia, because they've been involved with the community in many different positions. And we have worked with them in their many different positions, and they have always advocated, especially when it came to mental health. And so I think we've been fortunate to have them and their commitment to the community. So again, I think looking for community partners and that commitment is a key factor.
Well,
Absolutely.
and I'll just say, sir, if I can add to that, because
Yeah.
Dr. Muskie's comment triggered a thought for me, and that is, in some communities and in some states, different voices carry different weight. And here in Texas, our law enforcement voices have had dramatic impacts on our funding. Them saying, look, we need to invest in the mental health system. I can ask for it all day long, and people, frankly, they're like, oh, he's the mental health guy, or whatever. We'll see if there's anything left. But when the sheriff of Harris County shows up, or when the county commissioner advocates, or when other elected officials advocate, it does have a tendency to move the needle. And so for my behavioral health friends out there, don't be scared of that collaboration and partnership, because they can often have conversations and speak your name in places that you may not be able to get into. And it has a huge impact at times. They are some of our biggest advocates and supporters, honestly.
That's a great point. And those who attended our last webinar back in April, in Arizona, great example, the sheriffs ended up being able to approach the state legislature and get a state appropriation for some of their partnership, that work that they're doing with behavioral health organizations. So
We have a trade organization of community mental health centers. It's called the Texas Council, and the president of the Sheriff's Association has been on the board of that agency for, I think, the last 5 or 10 years, almost, whoever that president of the association has been. So we've seen that same level of partnership and, frankly, advocacy and support. They really feel strongly, and I understand why. They often end up finding themselves in very challenging situations because we've not been funded adequately as a system. And so, but it can make a huge difference for those mental health leaders out there. Don't shy away from it. Go have that lunch.
thank you for that. So Dr. Muzquiz, I have a question for you. So we talked very general, but what are some of the strategies that you think are best to address the needs of our youth and youth within the juvenile justice system? And what do you think are some of the low-hanging fruit that other jurisdictions can use to leverage resources to address those needs?
So let me go clinical answer your question clinically. So, the best strategy for youth involved in juvenile justice system is in multi-systemic treatment. It's called MST. I think focusing on evidence-based treatment models such as the MST show positive impacts for juveniles and their families. The research has shown for MST, it reduces criminal activity and then other undesirable behaviors. And when effectively implemented, these treatments can divert 87% of a youth of being rearrested. For those that don't know about MST, it's an intense family-involved and community-based treatment for juveniles who have serious criminal offenses, who are abusing substances. And basically the focus of the therapy, the strategy is to teach patients and the families how to foster success and recovery. I think the important thing about strategies for youth is it does take a village to raise a child. So having community partners, as we've been talking about with, not only our law enforcement, but, identifying champions within the community can help foster some successes for this. I think really finding and focusing on increasing more of Latino behavioral health providers in the community, peer specialists, and maybe promotoras de salud mental, so they can help connect resources to individuals that are seeking. So that's what I would see as low-hanging fruit.
Thank you for that. Yeah, I feel like we often think about adults, so it's nice to have a little bit of a conversation about our youth. So, and then thinking about a little more tailored programs, Sheriff Gonzales, I recently heard you have a women's empowerment center, and some of the great things that they're doing is a innovative, holistic concept. Can you tell us a little bit more about this?
Yes, I'm super excited. Thank you for asking. You probably see me just smiling ear to ear for this, taking kind of a difficult situation and trying to make it better. Within our jail complex, unfortunately, we have a lot of people that are obviously detained, and women in jails and in prisons, it's the fastest growing population nationally. So we're seeing a lot more women getting involved in the justice system, becoming incarcerated. And so what we did is we repurposed the space back to using what we have and not overthinking the money part of it. We put some fresh paint. We put nice quotes on the wall. We really made it a lot more of a softer approach, if you will. Our experience has been that women, jails were never designed for women in mind. So us trying to kind of soften some of the harder edges, both, literally and figuratively in jails, I think is very important. Look, within our own system right now, we have on average about 1,000 women that are incarcerated. And our experience has been that for most, there's some type of trauma involved, some type of mental health, perhaps a situation. There could be a trauma from abuse, sexual abuse, mental abuse, trafficking, you name it. And we need to unpack that. And too often we don't. We end up incarcerating for the what's at the surface level. If you remember, one of my first things that I mentioned at the beginning of this conversation was that we're in the front lines of 3 issues: mental illness, addiction, and poverty. And so that all feeds through that. And they end up becoming incarcerated because maybe they had an abusive boyfriend, or they were being pimped out, or maybe they were holding the drugs for the boyfriend and they end up taking the fall for the drugs. And so we're very heavy programming. For example, we provide exercise classes in the morning for those that are interested. At first, we only had a few volunteers. Now we had to buy more mats for them. We have education classes in there. We have an examination room where they could get woman exams. We have a small cosmetology room in there where they could have wellness days and self-care and things like that. So we're trying to kind of empower them once again to regain their power and hopefully leave better than they came out. Like I always say, most of the women that are in county jails will at some point return back into their communities. They'll be with you in your local stores. They're going to live nearby. They're going to be in your community. How do you want us to return your neighbors back to you upon release? And so taking that holistic approach has been so successful. We're seeing very positive outcomes. And back to your previous question as well about juveniles, I do want to mention this because we did some early studies when I first became sheriff back in 2017, is that this is going to blow your mind, Treasurer. Do you know that in our community, 90,000 children every year have a parent that's incarcerated in our jail? 90,000. We're a big jurisdiction. So, but if you scale that down, I guarantee you, everybody that's tuning in right now, you have children in your community, in your schools, that have a parent that's incarcerated in a local jail or prison, especially communities of color, because it's much more prevalent if you look at arrest rates. That's a whole separate conversation. But my point is, don't you think there's trauma involved in that as well? Knowing that now they have a single parent, no parenting or lack of parenting, lack of resources. And we expect those Latino girls and boys to thrive in your local schools. And when they don't, we deem them at being at risk, special program. We kind of cast them aside. Oh, he's not going to amount to much. He's not going to do this. Guess what? They end up becoming groomed for human trafficking. More trauma comes. It's almost self-fulfilling prophecy. We're creating these outcomes, and our leadership or lack of leadership is creating a lot of these systems that allow these situations to flourish. So it's a challenge. It's a call to action for all of you to use the information here today and have those conversations. As elected officials, you have a very powerful tool at your disposal, use it. And that's the power of convening. You are trusted, powerful elected officials in whatever your capacity is, whether it be elected sheriffs, treasurers, city council members, to say, I want to have a conversation, bring some people to say, what are you seeing in your local schools, the ISDs, around mental health? What are you providing? Is it bilingual information? I want to talk to our local police chief or sheriff and find out, what programs do you have available here? So all of these things are critical. But if it's happening in our community that we have 90,000 children that have a parent that's incarcerated in jail, it's happening in your community too. Maybe not as large, but guess what? They're supposed to be our future. And we know that statistically, if you have a parent that's incarcerated in a jail, you're likely to be 60 to 75% likely to end up becoming incarcerated yourself or dropping out of school and all the other things. And so just think about that in the back of your mind.
Thank you for sharing that, Sheriff. And yeah, it's a high statistic, right? But it's this reality, and you're right, in our, communities where the same thing is happening. And we need to not shy away from the conversations and to really work together. So before I turn open any questions, are there any final words or closing remarks that our panel would like to share? And so I'll start with Dr. Muzquiz, because you're right below me. So I'll turn it over to you first.
Yeah, my closing remark is well known, and we need to reduce racial healthcare disparities. We need to break down barriers. We need to, ensure that evidence-based treatment is available to, communities of color, and we need to make our treatments bilingual. We need to have our treatment disciplinary teams speak the language that these individuals are more comfortable with in efforts to get the results that we need. So.
Thank you, Dr. Muzquiz, and I fully agree. Wayne?
Yeah, I think for me, I would say, don't be scared of a pilot, right? Like the jail diversion center I mentioned started off as pilot funding for one biennium. And now we've got a jail diversion center that's diverted 8,000. We've got 5 others that have been started or are in process of starting in Texas. There's another one that's being started somewhere in Georgia. We've now got a youth diversion center that opened 2 months ago that we've diverted, dozens of youth from youth detention. So the idea of a pilot, don't be scared to start that. Our tablets went from 30 phone calls in pilot to now, between all the agencies, we've got close to 400 tablets out there. So leverage that opportunity, even if you don't quite have a plan, is exactly how to scale it.
Thank you. And Sheriff, any closing remarks?
Well, listen, I want to just thank and commend our fellow panelists here. It's such a blessing to work with such incredible leaders, both at a personal level with their own leadership capacity and skill set from Wayne, and also Dr. Muzquiz as well. I mean, seeing the growth of Harris Center over these last few years, we've been able to tackle Hurricane Harvey and a pandemic in a very challenging environment, and they've grown and thrived, and they've been an incredible partner, has been a huge blessing. And let's remember how we kind of got here in many ways, is that back in the 60s, there was a concerted effort that maybe it was well-intentioned to kind of move away from isolated, let's just hide people that may be struggling with mental illness and severe acute situations, and kind of close down those, far away, scary things where bad things were happening in these state hospitals, and let's move them all to the community. Unfortunately, what was missing was just that development of that whole infrastructure that was never developed, and the jails by de facto ended up becoming those places. And so these are incredibly challenging situations that it's not unique to Harris County, but I'm so, I'm a half glass full kind of person, always optimistic, and it inspires me to see the Sarah Benatars and everybody that may be out there, wonderful, talented Hispanic elected officials that are making impactful difference. Use your voice, use your platforms to make a difference on this critical issue. It's impacting the Latino community because we have a lot of work to do. We have to remove those stigmas. Even just finding a medical home, forget mental health. We know our parents many times didn't like to go to the doctor, don't like getting those prostate exams and other things that we have to have, And so, we have our work cut out for us, but again, with leaders like that are on this panel and tuning in, I think the future is very bright. And I'll close just by sharing our website, harriscountycit.org, harriscountycit.org. You could see our dedicated website to all of our programmings that are related to our mental health services and other community-based services that we offer. So tune into that, and we could be a resource to you. Please don't hesitate to reach out.
Thank you so much, Sheriff, and Dr. Muzquiz and Mr. Young for joining us. I know we are right at 10. If anyone has any burning questions, please put them in the, there's a Q&A in the chat. Again, I know I don't want to keep everyone too much longer because it is already a minute past 10. But if not too, if it's okay, anyone who's on here, if you want to email me your questions, we'll make sure to forward it to the panelists and make sure to connect you that way. And this is being recorded. Once we finish this up, we'll actually send the link to this and also to the last webinar. So you have this as part of our NACO mental health programming that we are doing. And it looks like we have one question. So thank you for your participation today and providing great information. Question is for Dr. Muzquiz. How do we reach out to female college students suffering from substance abuse and depression to get help?
I'm sorry, I didn't hear the question very well.
How do we reach out to female college students suffering from substance abuse and depression to get help?
Yeah, no, the issues of mental health issues and substance use and addiction in colleges is a significant problem. There are the community numbers, the helpline, there's a suicide hotline for them to reach out. But one of the things I wanted to encourage, and we didn't really talk about, but there are community educational classes also to emphasize for most of our colleges to take. It's called Mental Health First Aid. And I think this is a great program for lay people to take to help them learn how to deal and reach and work with individuals that are struggling with mental health and addiction. But I think the best thing for them to do is to get them to a provider who can evaluate and direct their treatment with them. I know that's an oversimplification of how to do that. It's not an easy thing, but I think making the individual feel supported and communicating and just enlisting their trust so that they can hopefully seek help.
Thank you. Do we have any other questions? I'll give it another minute. Okay. So, here we go. So great question. Thank you for joining this webinar. I have the same question. Tanya, how can we remove the mental health stigma within our own families?
Yeah, so if I can, I'll go ahead and answer. So going back to what I had mentioned before, so we have, as part of our treatment team, peer specialists. And these are individuals that have lived experience with mental illness, are on the road to recovery, they get trained, they get certified. I think that those individuals are usually the most effective individuals on our treatment team to reach out to family members who might not understand the stigma or might not understand mental illness and addiction. So I would, if possible, reach out to your local community mental health center and ask if they're peer specialists, ones that speak Spanish, understand the culture, I think is helpful. I think identifying or finding someone else who has lived experience, even if they're not a certified peer specialist, is usually the best way to go.
And as we give time for any more questions, I have a follow-up. Some of the programs and some of the things you're doing, both the Harris Center and Harris County, are those available online for us to look in Spanish? So, because you might have a resource at the Harris Center or even at the Sheriff's Office that I can bring to my family to, you know, help with that destigmatizing access to these resources. And so just wondering if it's available on your website that any of us can just go and look at and maybe bring back home.
We have the harriscenter.com link, and we can send some additional links that might be helpful for you to send out to the chat.
Okay, let me grab that. And then we'll do that. We'll include these links when we also send the recording out for everyone to have. So we'll send the link to the Harris Center. We'll send the link out to the Harris County Sheriff as well. Anyone else have a last minute question? If not, as I said, you can always email me any questions and we'll make sure that we forward it on to our panelists. Again, thank you guys so much. We really appreciate the time. It's always a pleasure. And those who are attending, keep an eye out. We will be meeting in person during the NACO conference next month. So keep an eye out for that email and then for the recordings and the links. Gracias a todos.
Gracias.
Bye.